everybody. We're going to get started, even though I'm hoping some more people will join us. My name's Kathy Focht. I'm a founding member of the Heart of Iowa Dems and chair of the Iowa County Democrats. Thanks so much for joining us tonight. Topic tonight is Medicaid. I'm sure we're all kind of up to speed, at least with the Medicaid work requirement bills that went through the House and Senate last week. As far as I know, I don't think Kim Reynolds has signed that yet. Somebody can correct me if I'm wrong. I thought it'd be a good idea to learn a little bit more about those two bills and what it means in real life, and also any thoughts on what might happen federally that will affect us Medicaid wise. Just a few housekeeping things before we get going. We're recording tonight, and I'll post those links on Facebook, or Kieran will post those links on Facebook and YouTube, and I'll get them all out to you tomorrow via email also. You can view a transcript tonight by selecting live transcription on the toolbar at the bottom of the screen. And if you have a question, just drop it in the chat room. I'm also going to drop the Heart of Iowa Dems email address in there in case you want to chat about something else at some point. Tonight, we're really pleased to have 4 guests. They all have kind of long resumes. I'm just going to be giving you a highlight. First is Dr. Arya Zandvakili, who's both an MD and a PhD and has been practicing medicine in Iowa for 5 years. He's the chair of the Iowa Physicians for a National Health Program. Zach Grissom is a first-year med student, Navy veteran of 9 years, and a founding member of Iowa Students for a National Health Program. I discovered them. They wrote an op-ed piece in the Des Moines Register about a week and a half ago, and it interested me, and I gave them a call, and they came along for the night. And I think Dr. Susan Dasovich is also connected to them. She's a retired pathologist in Iowa City. She grew up in Iowa City, went to med school at the U of I, class of 84, followed that by pathology residency at the Medical College of Wisconsin, and did private practice in the Milwaukee area. Senator Mike Zimmer, you might all be kind of familiar with by now. He just recently got elected to his first term in the Iowa Senate in 2025 in a special election. Yay, thank you for running. He represents Senate District 35 in Eastern Iowa, education professional, and now a professional politician from DeWitt, and he has taught, coached, and worked in administrative roles at various schools in Eastern Iowa. I'm going to hand off to Zach now, and he's going to get the show rolling, but please feel free to drop questions in the chat room. We'll get to them.
Hi,
Take it away,
everyone.
Zach.
Yeah, so Arya is going to pull these slides up for us. If you guys see our emails and want to reach out, please do so. We're happy to talk about things and kind of what is on your mind about the idea of single payer and kind of protecting the good parts of our healthcare system in the country and the state that we do have, and then also improving the parts that are not working so well. So if you want to go forward for me. Just some quick kind of basics about what is in this bill. So it's going to add work requirements for using Medicaid services or being able to have Medicaid under the health and wellness program, which is part of what's called expanded Medicaid. So that's for people who are low income but don't otherwise qualify based on those other things like disability and stuff like that. And they want you to work 80 plus hours a month and then be able to report those hours. The exemptions I've got down here, if you are, 18 and younger, or if you're 65 and older, if you have a high risk pregnancy, which they did not define anywhere within the bill or reference a definition outside of that. If you are disabled as determined by the Social Security Administration, receiving unemployment compensation, or medically frail under the Medicaid definition, the disabled and medically frail ones would already qualify, to my understanding, for regular Medicaid, not the health and wellness. So that doesn't change their ability to access it. And then substance use disorder treatment. So you got 6 months and you better be over it by then, is their thinking there. And then if you have a kid in the home under 6, so 1 through 5, and then this term otherwise exempt that they don't define. my kind of things or concerns is they don't talk about in this how you're going to report the hours or if there's going to be any sort of um, safety net if you are sick and you miss a couple hours and you hit 15 hours for a week. Like, are you just done for then and you've lost it? And then also, if you notice, it's only high risk pregnancy that's exempted from it. So otherwise, someone who's pregnant would have to work all the way through 9 months of pregnancy until they had a child under the age of 6 in the home after the birth. And that's what I've got so far.
So this is Sue, and one thing I just wanted to add to that was I looked up just for fun, what was the application form, and it's like 20 pages to fill out. I mean, it's onerous. So, and now this next one is my slide. I don't know if most of you know this, but rural hospitals really have a lot of challenges. And of course, Iowa being mostly rural, we have hospitals that are having those same challenges. And on the left is a map that this was from, I have the references there, but it was from an article that came out in 2024. So in Iowa, we have at least 5 hospitals that are at risk of closing in the next year or two. And I think with the Medicaid expansion, that was really helpful to our rural hospitals because they obviously have smaller populations to have as clients. So that affects them when they lose that. I apologize. My sister's dogs are going wild here. I've got the door closed, but they're barking. So that affects their bottom line when they lose that Medicare revenue, Medicaid, I mean. And so then on the right, I don't know how much you guys know about Medicare Advantage, but there's traditional Medicare and then there's Medicare Advantage, where that pot of money goes to a private company. And then instead of the usual Medicare payments from the government, the hospitals get their payments from those private companies. And there are a lot of problems with this for hospitals and getting paid from Medicare Advantage. But again, they hit the rural hospitals harder. So this on the right, the shows some of the different things. So in traditional Medicare, you get really the payments are set, but then with Medicare Advantage, the hospitals have to do negotiations every year for how much they're going to get paid. And because there aren't very many different companies and they have a lot of power, the small rural hospitals usually get paid less from the Medicare Advantage people than they do from regular Medicare. And then the second thing is usually with Medicare, things are more straightforward and you don't have as many pre-authorizations, whereas with Medicare Advantage, there's lots of pre-authorizations and denials. So that complicates care and delays payment for care. Let's see. And then the other thing that this article has said that a lot of the regular Medicare seems to pay more on time and they can count on it more, where they're seeing lots of delayed payments with the Medicare Advantage. And so really you see with the traditional Medicare, it really promotes more stability, not just for rural hospitals, but rural hospitals are the ones that have more trouble with staying afloat. So our traditional Medicare is going to help our rural hospitals in Iowa, whereas the Medicare Advantage by the private companies often puts their survival at risk, and they end up cutting services or closing.
I got a question in the chat I wanted to throw to Senator Zimmer. Work requirements. What happens if the person has trouble getting hired? Does applying for work count, and how?
Well, thank you. That's a great question I asked. So again, just like as poorly written as this bill is, there's another one of those where what happens when the employment situation is high, where I think we're going to be heading. What happens then? If you apply, do you have to sit there and work through the same thing as unemployment, where you have to demonstrate? No one knows. Asked and no answer. I will also say that we asked for a fiscal note regarding how much this was going to cost HHS to put in. It was asked weeks before from HHS for a fiscal note on, and they ignored the legislative service agency. They would not respond despite repeated requests from the legislative body about this. And when we finally got to the spot where the bill was on the Senate floor, and we were going to actually basically rule that this bill could not be discussed because there was not a fiscal note, the HHS came back and said, take a look at Arkansas and take a look at Georgia to see what it cost them. Well, we're not those states, but the bottom line is it costs more money to set this system up to track all of this than what the savings are. And that's been documented repeatedly when stuff like this is put in.
Yeah, I was looking at the legislative services agency brief, and their thought is that their kind of goal with this and what they mapped out is that 32,000 people will lose their health and wellness plan coverage based off of kind of just some numbers that we referenced from Kaiser Family Foundation in the Des Moines Register article, and that they're referencing here, and they list as sources Arkansas, and that is expected to save in fiscal year 2026 3.1 million and 17.5 million in fiscal year 2027. Senator Zimmer, what's the current ask for the whole budget of Iowa for fiscal year 2026, if you happen to know?
Yeah, the governor submitted I might be off a little bit, but I believe the governor's total budget request for FY26 is $9.4 million. And the March Iowa revenue estimating is saying that we will bring in 8.5 million. And House Chair Gary Moore, House Appropriations Chair Gary Moore, stated that at Friday at a Quad City chamber meeting that this was all part of the plan, that the state of Iowa has $6.9 billion in reserve, and that their goal is that they'll cover the gap between a revenue coming in and the expenditures they'll pull from our savings, or in other words, the Iowa Taxpayer Relief Fund. That's what we're going to do.
So by my napkin math, that's looking to save 3% of a percent in 2026 out of the 9.4 billion budget by saving 3.1 million, and then less than 1/5 of a percent in FY 2027 if they were to ask for a similar amount. So we're talking less than pennies when we look at the whole state.
Zach, if I might add, Representative and Chair of Appropriations Gary Morse further stated that Iowa's #1 expense is going to rapidly become Medicaid payments. And the whole thing, read between the lines, is the goal is to do everything possible to get people off of Medicaid. And that was also the Work Without Worry bill that hasn't emerged yet. But that was another attempt on both ends to get people off of Medicaid.
Yeah, and it looks like there's not exemptions for students of any kind either. I noticed that Representative Levin is on the call. I was wondering if you would be willing to unmute and maybe share some thoughts about the House version of the bill. Not to put you on the spot.
I am actually driving, so I'm probably not your best person
Okay.
right now.
Okay,
Sorry.
Sorry,
We're happy
Eleanor,
to
that was
listen in,
me.
but no, that's all. It's all good.
It's me that put her on the spot.
Yeah. So with the goal of trying to get people off, that seems like that's really going to impact people's opportunity to stay within the state and kind of get a foothold in their families for a lot of young adults in rural Iowa trying to start families and stay in the place that they've grown up in. Arya, if you wanted to move
Sure,
forward.
yeah. So I think we've heard some pretty worrisome things between the attacks on Medicaid, which is like work requirements happening at the state level. At a federal level, there is that budget reconciliation that happened a few. There was that budget reconciliation that happened a few weeks ago that was saying that about $800 billion needs to be cut from certain benefit services like SNAP and Medicaid. And then there's also the attacks on Medicare as well. So trying to privatize Medicare as much as possible. So this is getting at what Sue was saying about there's a lot of forces within the right wing that wants to take people off of traditional Medicare and put them into these Medicare Advantage programs, and to actually make traditional Medicare worse so that people move themselves off into Medicare Advantage. And I think this it's very natural to feel despair in this situation because it feels like Republicans have, or the right wing has, like all the control right now. But I do want to share a story, and that's I was actually working in a hospital this weekend, and I saw a patient with uncontrolled diabetes and a diabetic foot infection. And he had his MAGA hat on, and you could tell that he was, very pro-Trump. And then I was trying to figure out, as this physician, trying to figure out why his diabetes was uncontrolled. What could we do to help him prevent getting another diabetic foot infection? And he said it's because of so I asked him why couldn't he get his diabetes under control? And he said it's because of the damn insurance companies. And he basically, what happened was that he got ill the year prior, lost his job. So then he lost his insurance, and then that made it harder for him to control his diabetes. And now he's back in the hospital because of that. And he mentioned also that he said everybody's pissed off at insurance companies. Why are they getting inside of our care? And that's why that guy in New York got shot, is what his words were. And I think this represents kind of a sentiment that crosses, political parties. I think as the right wing is taking away people's these benefits, and that they're firing people from federal government, you're going to get more and more disgruntled and angry people. And the people on this call, we're activists, we're leaders in groups, and so it's our responsibility as this the sea of angers that's going to come is to direct it at the right target and to take that energy to the right solutions. And so I think this is, so as bad as everything is getting, I think there's opportunities that's going to come up for us to be able to put in better policy. And so at Physicians for a National Health Program, what we really think is going to be the policy that protects healthcare is Medicare for all, or what we call single payer. And this is and for those who are not familiar with it, I think most people are. It's like Medicare, but better. So basically, you get all the care that we need. So this is not only going to cover your hospital stays, but it covers prescription drugs. The plan is that it would also cover ancillary services like eyeglasses, dentistry, hearing aids. And then there's not going to be any co-pays, deductibles, premiums, or supplements. So it's like, by the mere fact that you're an American, that you get your healthcare covered in this program of Medicare for all. So it's kind of like being funded by your local fire department. You live in the town, the fire department will help you when your house catches on fire. You don't need to be going to buy fire insurance for the fire department to come help you. And so again, nobody is left out of this. So we're all included in the same plan. So what that does is that it helps reduce the cost of administering the program, and that's what is where that cost savings comes from, is so that hospitals are not having to contract with a million different health insurance programs. We are all under one program, so that the administrative costs and wastes go down. And then finally, it's about freedom. You get to personally choose what doctors or hospitals you feel are best for you without financial barriers. There's no out of network physicians, and that there is no tie to being you're tied to your employer in order to get health insurance. And so, and at a point that I want to make that I didn't get to make earlier is that it basically is that all of our hospitals, we all share the same hospitals. So regardless of whether someone's on Medicaid or Medicare and you're on like a private plan, the money that flows through the public through those public plans like Medicare, Medicaid, that covers other people that covers other people, that money goes to your local hospital. So regardless of whether you're on Medicare or Medicaid, you're benefiting from Medicare and Medicaid to fund your local hospital, because the local hospitals have the shared resource that we all use. And so how is Physicians for a National Health Program trying to promote single payer? And we're doing it in 3 ways. One is that we've got a legislative component to it. And that's where we have what we call our triple aim. So we are trying to do 3 things. One is to end profiteering within healthcare, whether that's with the health insurance companies, or that's with like private equity buying hospitals. So we're trying to call out those problems within health insurance. The other thing is that we're trying to improve traditional Medicare and to protect Medicaid. And then as we do those, we're trying to get to our true north, which is single payer or Medicare for all. That's kind of like our long aim. The next thing is that so I should say with the legislative branch, this is where we work with politicians and we lobby politicians to sign on to policies that kind of help with that traditional, with that triple aim. Next, what we do is we do what we call narrative work. This is writing research articles or reports that kind of show what are the economic impacts of going to a single payer, or try to document how people struggle with private insurance. So getting that data out there so that people understand the effects that health insurance is having on people in the US. And then the next thing we do is we organize and we collaborate with other groups, kind of like how we're collaborating here with Heart of Iowa Democrats. So getting a little bit more into the legislative component, what we've done is for years, we've been helping write the Medicare for All bills and getting co-sponsors onto these bills. And then we've been working also on policies that would help reduce the privatization of Medicare. So we've been working on that for a number of years as well. So then that gets kind of, so that's kind of at more of a national level. What can we do here at the level of Iowa? So I think at a state level, as we see attacks on Medicaid coming up, or if we see other problems like with if we get into further attacks on like reproductive health or trans health or other things, we want to be lobbying as much as possible to help protect healthcare that way. And then at a federal level, we would really love to see if Democrats could run nominees that put Medicare for All on the forefront, because I think there is, if we help shape the narrative, I think that there is a hunger for this type of policy. And then the next part is we need to keep doing editorials within our local newspapers, getting the word out, so that helps shape the narrative. And then finally, with organizing, we're doing rallies around healthcare, doing teach-ins. So we'd be happy to come and talk about healthcare issues at different groups. If there's any group that wants to learn a little bit more about the nuts and bolts of single payer, we can come give talks about that. And then finally, one idea that I've been toying with is if politicians have town halls, that's, I think, a great opportunity to put pressure on them about how are they going to be protecting Medicaid? How are they going to be, so having somebody go to those town hall meetings and questioning and bird dogging the politicians to see how they will protect rural hospitals. How are they going to make sure that there's public financing that's going to prevent the rural hospital from cutting services? And so I think that's a way to put pressure on Republicans, and then also to educate the people within the town hall about what's going on. And so us here in Physicians for a National Health Program, we'd love to collaborate with you all on these efforts or any other ideas that you have. So with that, here's our emails again, and here's a QR code that will send you to the Physicians for a National Health Program website. And you can sign up there. You don't need to be a physician. You can be any type of healthcare worker, a non-healthcare worker. We are open to all sorts of people. So thank you.
If I might be so bold, Arya, I would say that those are laudable goals, but I would also like to remind everybody here that Eisenhower tried to get national health insurance. United Steelworkers blocked that because that's something they wanted to negotiate for their members. You know this. And then also fast forward 40 years, Obamacare, the Affordable Care Act, the Democrats went to the line on that, and the voters voted them out, and we've not recovered since then. And the result has been the current Supreme Court that we have right now that has taken us back decades. So I guess what I'm saying is that I do not see right now a Democratic legislator taking the front on this, because they will get their hat handed to them, and we will stay with the current supermajority of Republicans that we have right now, in which we are talking about the Senate File 615 on the Medicaid cut. They're going in the opposite direction thanks to the Koch brothers. So this hill is going to be, I would suggest, basically at the grassroots level. And quite honestly, it's going to take something catastrophic to happen at the Medicare and Medicaid level that impacts people personally, that all of a sudden they start realizing, oh my God, what is happening? So I don't mean to be fatalistic, but I'm trying to be realistic right now, that if right now in this current climate, if there was a Democrat to be taking the point on this, it would be because this is the last election that they were planning on having.
Yeah, something that I wanted to kind of jump in before I relayed a question from the chat is that when you go to these town halls, or you ask for your, U.S. Congressional and Senate delegation to come back and actually do town halls, actually show their face, be smart about who you are bringing this up with, and put pressure on the idea that they are harming Iowans, and you want to be speaking to your neighbors about the other neighbors and what that impact is at the local level. Something I had shared with another person in the chat is doing things at a municipal level. So asking and starting to do a petition to get your local city council to adopt a platform that supports that, or is doing something else there at a local level, because that is where that next generation of politicians kind of first gets their feet wet, is in city elections, is working on school boards in local areas after being a community member for many years, and then they can step up further and further as their name gets known wider and wider. Senator Zimmer, I wonder if you would be able to answer, outside of Medicaid, are there any noises being made about changes to how Medicare functions in Iowa?
No, I have not heard anything on the Medicare side of it. I think everybody's kind of waiting to see what happens with this current administration and what's going to occur month by month. And again, my mantra has been, it doesn't become real until it becomes personal, and it's going to become personal for a whole lot of people. And then there's an opportunity to start having a conversation about everything that Dr. Zandvakili talked about, of which I am not disagreeing with. I'm just trying to give the reality. And again, in my situation, if any county could use Medicare for all, it'd be Clinton County, because of the poverty rate and everything. But the folks just don't see it. They just do not make the connection.
Yeah, my experience, I know that Jackson County, just a little bit north of you, there's one dentist in the entire county that takes the Iowa Dental Wellness Plan. So he is the only option for people to get dental care in that whole county, if they're using that. And then there's also with the way that we administer Medicaid in this country, of still having insurance companies as the middleman for those dollars, there's also still networks that you have to work within. So this primary care office might take it, this other one might not, even though it's all coming out of the same public dollars ultimately.
Yeah, I was just gonna say that I appreciate your viewpoint, Senator Zimmer. And I do think I agree that I think it's going to be a long road towards single payer, but I think as people get, like you said, as people have personal experiences that are going to be detrimental to them, and this is what's going to happen. And so as they're doing cuts, I think that is the opportunity where we have do one-on-one discussions with people, or we try to set up rallies throughout Iowa to be able to get people on our side. And yeah, I guess I'm fearful for what's coming up, but I do also think that it provides opportunities.
And this is Sue. I agree with that. I get, I get why you're trying to be realistic, but the realistic thing, this expanded Medicaid was because there's this whole huge group of people that didn't make enough money to get Obamacare subsidies, but they made too much money to be on Medicaid. And they basically did that end around because they couldn't get, it was a way to try to get more people covered, and with the hope that things would evolve. And they haven't evolved except in a bad way. So, I don't know. We'll see. I think we are going to be in crisis times. And as rural hospitals close and, I think it's going to make, and the irony is, I mean, they talk about fraud and abuse and everything, and I think it's more about just not paying than it is about fraud and abuse, because if you looked at all the Medicare Advantage stuff, that should be easy pickings for fraud and abuse, but nobody's talking about getting rid of Medicare Advantage and the profiteering in that. So I get what you're saying, but I'm hoping that as we go forward, it gets worse and worse, that maybe people's eyes will be opened.
Senator Zimmer, I had a question for you. So I noticed in the tail end of the Senate file, it says that if federal rules about work requirements were to change, that Iowa HHS would be required to petition to completely remove the health and wellness plan. What do you know about how we would need to go about removing that or changing that law if it were to be signed completely as is, to protect the health and wellness plan like as it stands if federal rules were to change on that?
Zach, I'm glad that you got that, because I had that section pulled right up on my computer, because that was the poison pill language. It was one thing to talk about the work requirement piece, even though 39 agencies that work with Medicaid people signed against this, declared against this on the bill, when it says, just as you pointed out, if federal law or regulations affecting work requirements for the Iowa Health and Wellness Plan, which is our Medicaid expansion, are modified to exclude work requirements as a basis for maintaining eligibility, as provided in this section, the department shall, not may, shall discontinue the Iowa Health and Wellness Plan subject to federal approval. And then it has the other sentence after that, if federal law, the department is not allowed, then Iowa Health and Wellness Plan, they're not giving up. Then they want to have be able to implement an alternative plan. And so that's the piece that I just railed against. I talked about in my my newsletter, I mean, to ad nauseum, I said, this is what's going on. And people were like, oh, you're just getting them to be panicked and worked up. I said, I'm not getting them to do anything. I'm just reading the language in the law, and words mean something.
Yeah, they especially mean something when there's how many pages is that thing across the Senate file? Is it 3 or 4?
Well, there's 3 divisions,
Yeah.
and the total bill with the explanation, it's not that long as far as reading goes. It's 5 pages and a paragraph.
Yeah, and so that kind of is absolving the legislature, it seems, of a lot of a responsibility of actually defining what they mean. So then these requirements, like how a work requirement reporting is going to be administered, or any sort of grace period if you were to miss it for 1 month due to illness or any other reason. There's no protections for people if they are just simply scheduled just 2 days a week for something. They're working 16 hours, they're working as much as they're able to find work, but they don't hit the 20 hours.
Well, and Zach, I appreciate you saying this because, and this is for all of you, when the legislature when they're not specific in a bill and it gets signed into law, then it's left with the departments, AK in this particular case, the Health and Human Services Department. They'll come up with their administrative rules. In other words, we basically defer any of the legislative's power to the executive branch. We just hand it over to them, and we let the governor and the departments decide how they're going to define that. Exact everything that you're asking about, that will become administrative rules. That's what will happen, written by HHS.
And Senator Zimmer, don't you think they do that on purpose? Don't you think that was purpose of being vague, is that then they could make the rules that they wanted?
You know what? The beauty of a conversation like this is that you answer your own question. Duh, yes.
For Dr. Zandvakili, Arya, there's a question in the chat, and I don't know if we've talked about this some, but from I don't know if you see it. What kind of work, if any, is PNHP doing with the Iowa Hospital Association to try and understand rural hospital plight, and would they advocate for a single payer?
Yeah, so this is an interesting question. So there is one component to answer the question directly. We are working with hospitals to get basically to work on a policy that would require Medicare Advantage to become more transparent, and so that we could be able to better assess the waste and fraud that happens through Medicare Advantage. And just to remind people, Medicare Advantage is basically, it's the idea of the government, which normally administers Medicare, they basically give money to a private health insurance company for them to be the ones that administer Medicare. So we are working on a project right now with a colleague named Mike Craig, who is trying to rally hospitals within Iowa and other states to support this policy to have more transparency with Medicare Advantage, and then use that to then lobby politicians to support this policy. So there is that work. I will say there is a tricky part, which is that a lot of hospitals are also, while they might be nonprofit in name or by designation, there is a component of them that they're very worried about their about expanding and increasing their revenue, and very worried about their bottom line. So there is the those economic forces at play at them, and they are worried about what single payer would mean for them. So traditionally, the American Hospital Association has been against single payer and Medicare for all, and they've fought it. So it's kind of a tricky relationship with them. We want to be able to protect hospitals because that is how we get healthcare to rural America and to rural Iowa. But we also want to help convince them and to lobby them to be for single payer, because that would mean that they get a steady revenue stream. To get a little bit into the details with single payer policies, generally what happens is instead of hospitals billing for individual services that they provide patients, they would go under a plan where they'd get a global budget. So the state or the federal government would estimate what the budget the hospital would need for like the next quarter or for the next year, and just give them that money. And then the hospital could then function. So they don't need to, so the administrative costs go down substantially through that type of mechanism. And then the hospital has a guaranteed source of income. Yep.
And then two questions that were submitted ahead that I want to make sure that they get answered. How will these changes affect someone 90 years old? So just to make sure that I said it, if you are 65 or over, you're exempt from the 80-hour work requirements, same as for if you are 18 years and younger. And then how is it determined if a person is fit to work? Again, that goes to the Social Security Administration definition of disabled, or the Center for Medicaid and Medicare Services for medically frail. Medically exempt is the other term there. So those are, again, people that are already qualified for other government-based health benefits to be able to get their care anyway. And then Arya, what orgs are working with Iowa PNHP on single payer advocacy?
Yes, so we actually just started less than a year ago. So we're still trying to form those relationships right now. So we don't have like necessarily a like we haven't worked on an active project with another organization yet, but we are open to working with others at this time. So we're trying to develop those collaborations. So I'll say if anybody is leading any other organization, please feel free to reach out to these emails here so that we can set up collaborations.
I'll make sure you get the emails in the email that goes out tomorrow too, their email addresses.
Zach, or who are kind of facilitating, there's a question on here by Terry Stewart, said, what can be done to caution and steer people away from the Medicare Advantage? I know that I'm at that spot now where I'm just getting bombarded with enrollment information. I will turn 65 in September, and now's the time I'm like anybody else for just getting slammed with stuff from Medicare Advantage wanting my business. But the flyer that was posted here on this slide presentation, where it had the thumbs up and the thumbs down, that column comparison, that's the kind of stuff that needs to be incorporated into the information provided. Yeah, that one. Yeah, thank you. Right, that one right there. Why rural hospitals are struggling with Medicare. That traditional Medicare versus Medicaid Advantage or Medicare Advantage. You have to dig to find that kind of information because there's so much money at stake that the insurance companies offering those Medicare Advantages, they're just overwhelming with mailings, and it's easy for that kind of stuff to get buried. But that's the kind of information that we need to get into hands for people like myself that are approaching getting enrollment.
There is a, a one-page thing that PNHP has on, the problems with Medicare Advantage. And I personally have talked to many of my friends about, why you shouldn't get Medicare Advantage. And it's basically, it's great until you're sick and get denied care. And also, it costs more than you expect it's going to, but their marketing is so good. Oh, you're going to get all this. You're going to, and I think it's also hard for people who really can't afford the Medigap premiums. They say, well, I can get coverage and I don't have any extra premium for that. So, but in the end, it's not good for taxpayers either. And then when people are sick, they often have trouble getting care. And so that's what I talk to people about all the time. But I've had friends that, well, the economics say I need, I'm going to get Medicare Advantage. And again, I think it was one of those things that was set up. I mean, I think the lobbyists wrote the law. They get more, it costs Medicare more, but yet they give, the insurance companies more money than for regular Medicare. But again, it's one of those things that PNHP is really working on, but it's hard when people can't afford the premiums and I even know people who can well afford the premiums and they say, well, I get a gym membership and I get this. And, so you get the cheap stuff. And then when it comes to the big stuff, you know, you don't get it. And especially like if somebody needs to go to a rehab hospital, forget it with Medicare Advantage. I've had multiple friends tell me, they'll come in and their parents need to go to rehab and the doctor says, what kind of insurance do you have? And I hope it's not Medicare Advantage because I'd like you to go to rehab, you know. So we keep talking about it, but you're right. It's hard to counteract all that advertising.
Susan, that was just a phenomenal summarization of what's going on. And we need to get you recording and then we put that out. But the bottom line is there's so much money that we're up against on the advertisement portion. It's our voices just get completely drowned out.
We're getting close to 8. Do the panelists have any closing thoughts they want to share, or are you all closed out? Mike, your mouth is moving, but you're muted.
I was talking to my wife in the background
Oh,
about Zach's
sorry.
summary. No, it's okay. About Zach's summary there. I'm going, oh my God, we just went over this when she went on to Medicare. Zach, great job.
Yeah, I guess I just wanted to say thank you for having us and my co-panelists here. This has been really fun being able to talk here. And then just to reiterate that I think it's individual conversations can be really important to have. So if you have friends or neighbors or somebody that you see at the gym or something like that, you can start off these conversations. Those individual conversations can have an impact on people if you and it just kind of requires understanding where the motivations that other people are coming from, and you can kind of direct them to understand that we all share these hospitals and that we need to protect them through good, solid public financing. And this is why it's so important to protect Medicare and Medicaid. So that's kind of where I will leave it. And then actually one other point is I really do think that we have opportunities coming up. So we should just keep up the fight here.
I agree with all the above. Want to thank you all again, Dr. Zandvakili, Dasovich, Zach, and Senator Zimmer. Really appreciate the work you do, and also thanks for sharing your time this evening. In addition, I want to thank Kiran Patel, who's behind the scenes and kept it going when I fell off there for a few minutes with some tech problems. A reminder that the recording of this event will be available tomorrow on both Facebook and YouTube. I'll send an email with those links. And if I could get the slides from whoever did this slideshow, I could share those too in that email. That'd be great. The next Heart of Iowa Forum should be on Wednesday, May 7th. Topic to be determined. There's no shortage of those right now. Also, I wanted to mention one thing. We were talking about telling stories here tonight. I forget the name of the program. Ed probably remembers, but the IDP is Iowa Democratic Party is collecting stories right now for exactly this reason. People's not what your neighbor did, what happened to you personally. So they have firsthand stories of people. I would also encourage you to, talk to your county party. If they have a Facebook page, you could post your story on their Facebook page, write a letter to the editor. Personal stories count. I'm going to close this evening by encouraging all of you to attend a hands-off protest this weekend. Saturday, April 5th, all over the U.S., hands-off. Protests are happening, and there's plenty of them in Iowa. So I'm going to throw into the chat room where you can go and find out where the closest one is to you. I get myself back in the chat room here. Just you'll go in, put in your zip code, and it'll tell you the closest one on all the major cities in Iowa. There's also some in small towns, which is great. So please do that. And that's it for us tonight. Appreciate you being here.
Thank
All
you,
of you.
Kathy.
Thank you.
Thank you.
Thank you.